artificial or there are no gels. I'm going to look at my physician's order. I'm going to gather all my supplies and I'm going to go into my patient's room. I'm going to knock on the door. I'm going to introduce myself. Hi, Joe. My name is Melanie. I'm here to perform your central line dressing change. Can you tell me your name and date of birth? And he does. I'm here to perform this dressing change. I'm going to perform hand hygiene. For this dressing change, I'm either going to need you to turn your head or wear a mask, and he's going to wear a mask. So I'm going to apply my mask first. And then I'm going to put on Joe's mask here. I'm putting Joe's mask on after mine so that I'm not touching him and then touching my hair, my face, my ears, and getting his germs on me. I'm going to perform hand hygiene. I'm going to now apply my clean gloves. Okay, so with my clean gloves on, I'm going to anchor with my non-dominant hand the tubing. I'm going to pull the dressing off parallel to the skin. I'm going to do all four corners and pull away from me towards the insertion site. If I were to pull from the insertion site towards me, I risk pulling that catheter out. So I'll pull off this corner, that corner, this corner, and this corner, and then gently pull it completely off. I'm going to discard this dressing. And now I'm going to look at the insertion site. With my clean gloves on, I'm going to ask Joe if he's in any pain. I'm going to look at the insertion site for any drainage, redness, swelling, any irritation of the skin or rashes. I'm going to look at the catheter to see if it's dislodged or kinked or any abnormalities with that. And then I'm going to look at the surrounding skin. I'm going to look to see if there's any drainage, redness, swelling, see if there's any pain. Then I'm going to discard my clean gloves, perform hand hygiene. And now I'm going to begin the sterile portion of the procedure. So at this point, you want to make sure that everything is in view of the camera. If you need to adjust so that everything is seen. So the central line kit, I'm going to open it away from me. I am going to pinch down the lid so that it stays open, so that the lid does not fall upon my kit, so that once I have my sterile gloves on, I'm fishing in there to get what I need to clean the dressing. I'm now going to pinch and take my gloves out. I'm going to open them using that 1-inch border. And now with my gloves, I am going to glove my non-dominant hand first. I'm going to take my dominant hand and pinch the cuff and take my non-dominant hand and apply the glove. You don't want to apply the glove over the wrapper because you may end up touching the wrapper and contaminating the glove. And then with my non-dominant hand, I am going to reach in and scoop the other glove and apply the glove to my dominant hand. Now that my hands are sterile, I cannot go below my waist. If I want to remain sterile, I cannot touch anything that is not sterile. So in my kit, I'm going to grab my chlorhexidine. I'm going to pinch it. I'm going to hear a crack if it wasn't used already. I'm going to allow the swab to fully saturate. I'm also going to grab my gauze. This gauze pad I am going to use to pick up my tubing so that I can clean all four sides of the catheter. Now that this is saturated, this is chlorhexidine, so I'm going to clean in a back and forth motion for 30 seconds. If this was alcohol, I would clean it for 30 seconds in a circular motion. And I'm going to clean the area the size of the dressing. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now that the entire area and the insertion site are clean, I'm going to clean my tubing. I'm going to clean the underside so that now if I were to drop it, my surface area is clean and this will not contaminate it. And then I'm going to clean the upper side. And then I'm going to set this down. I'm going to allow and discard my chlorhexidine and my gauze pad. I'm now going to allow this to completely dry before I apply the dressing. Depending on how saturated you make this, it may take a while, and hopefully it does, because the point of cleaning it is to get rid of all the bacteria. Now that it is completely dry, I'm going to take my Tegaderm. I'm going to peel the backside off. I'm now going to apply the dressing. I'm going to cover the insertion site. I'm going to try for as few wrinkles as possible. And then I am going to pull off this outer border. And I'm pushing down as I go to make sure that the dressing is completely secured. And then on here is the area to put my date, time, and initials. Okay, and then I'm going to put this label on the side, not over the insertion site, because we want to be able to see if there's any drainage that it occurs. Now that the dressing is on and secure and date, timed, and initial, I am going to dispose of all my equipment, even my pen. I'm going to remove my gloves. I'm going to perform hand hygiene. I'm going to remove my mask. I'm going to remove Joe's mask. I'm going to ask Joe if he needs anything. I'm going to perform hand hygiene. I'm going to lower him down, give him his call light, make sure he's safe. I'm going to go out and document. So that is your central line dressing change. I do want